Of the 45,000 Queenslanders who've been asked to quarantine, 1,432 of them are in the Cairns region, and about 1,200 of those quarantine orders remain active. The fever clinic here in Cairns saw 34 people in the last 24 hours, bringing their total to 632. Tragically, though, I can also confirm that Queensland has recorded its third death in Queensland and its fourth Queensland death overnight. An 85-year-old male passed away in the Darling Downs Hospital and Health Service at the Toowoomba Hospital overnight. And of course, all of our condolences, the condolences of the whole of Queensland, go to that gentleman's family, which is, of course, grieving right now. And each of these deaths reminds us of just how important our effort to stop the spread of this outbreak, to slow the spread of this outbreak is. The longer we can slow it, the better our hospitals will be able to cope with demand, the more lives our doctors and nurses and health staff will be able to save. And that is what is at stake here. Queensland lives, people in your community, your neighbourhood, maybe even your family. And so when we ask you to do things which are often inconvenient, sometimes very inconvenient, sometimes very impactful on your work or your business, please know that we are taking this seriously because it is serious. This virus is deadly. Here at the Cairns and Hinterland Hospital and Health Service, they've done a fantastic job of preparing for a potential outbreak of COVID-19. Last week, the Palaszczuk government announced we were investing a further $1.2 billion into our hospital and health services, and we would expect Cairns and Hinterland Health Services share of that to be roughly $152 million. That will allow them to expand their fever clinics as required, to deliver more health services in the home and into aged care facilities, to expand intensive care, ward and emergency department capacity, and of course do all of that while continuing to deliver the urgent and critical services that our health services have to continue to deliver. We can't stop delivering babies. Sadly, we can't stop people having heart attacks and strokes. We need to make sure our hospitals can keep doing that urgent emergency work while also dealing with what is likely to be a large influx of COVID-19 patients.